Could that common painkiller you take actually be messing with how you heal after surgery?
Managing pain after surgery is a huge challenge for doctors. It's a real balancing act. You've got opioids, which work well, but man, the addiction risk is just massive. So naturally, many people turn to safer, non-addictive options like ibuprofen, also known as NSAIDs. But surgeons had this nagging feeling, especially when it came to bone fusion surgery, or arthrodesis. And here's the catch. Healing bone needs inflammation. But what do NSAIDs do? They stop it. Which leads to a wild question. Could the very drug for pain actually stop you from healing right? So, researchers decided to find out. Their first guess? Nah, NSAIDs are probably fine. To test this, they did what's called a meta-analysis, basically a giant review of past research. And when I say giant, I mean it. They started with over 3,000 different scientific papers. After getting super strict with their criteria, they whittled that list all the way down to just 13 studies. So they crunched the numbers and nothing. The results were kind of fuzzy. No clear risks showed up. But then they had an idea. What if they split everyone up by age? And wow, that changed everything. Let's look at the kids first. For them, there was absolutely no link to poor bone healing. So for children, it seems these painkillers are a perfectly safe option for recovery. No problem. But for the adults, it was a completely different story. A really obvious risk suddenly appeared. Get this, adults taking NSAIDs had a 72% higher chance of their bones failing to fuse correctly. So you have these two totally opposite outcomes, and it all just came down to the patient's age. So what's the bottom line? For adults, these common painkillers hide a serious risk after fusion surgery. This is huge info for doctors, especially since it completely flipped their own initial guess. Of course, the researchers say we still need more studies to really nail down the perfect pain plan. It just goes to show you, always talk to your doctor about every medication you're taking.